To the ration care debate, Senator Ted Kennedy suggesting government-run health care may include some rationing of hospital readmissions. This coming from a senator who at age 77 revealed that he had a malignant brain tumor on May 20th and on June 2nd underwent surgery. Well, Shona Holmes also suffered a brain tumor and says if the senator lived in Canada, he'd still be waiting. By the way, we said that Shona had cancer in the T's. We apologize. Her tumor was not malignant. We're happy to say she's alive and well. So very good to have you, Shona. Thanks for coming.
Thanks for having me, Neil.
All right, now, whether you have a malignant tumor or not, when it's in your brain, it's dangerous. And tell us a little bit about what you experienced and what you wanted to address.
Well, this is something that I've noticed that's been really prominent in this debate, is it now comes down, well, really, how sick are you and how much trouble are you in? And it's almost like we get discriminative about the type of diseases that you have and whether or not, you know, and so that's something that we should maybe be looking inwards within ourselves to correct. But in my situation, you know, I got very sick and I was showing some very worrisome symptoms, and I went to see my family doctor, and I was going to be, from the onset of my symptoms, I was going to be 4 to 6 months in order to see both of the specialists that I was required to see.
Even though you clearly had something bad going on in your head.
Yes.
And they told you...
Clearly with symptoms.
Clearly with symptoms. In other words, I would imagine there was some sort of paralysis and that kind of stuff.
Yeah, well, what had happened, I had lost 50% of my vision, not to mention crushing headaches and very, very obvious physical changes. And the problem is, and that this is a big thing that gets lost in the debate, and this is why I've kind of come out and spoke about it, is because Canada talks about wait times, and those wait times go from the time you actually are with that specialist and they have determined that you need surgery. Those wait times do not include the wait time to get in to see the specialist, the wait time for the diagnostic imaging, the blood tests, and all of those sorts of things.
So you had you clearly had an urgent case. I mean, you were hurting, and you were still told you'd have to wait. So you took matters into your own hands, mortgaged your house, went to the United States. Then what?
That's right. I came to the United States and I actually came down the first time to get just diagnosed, and they told me to go home, gave me my diagnosis and said, Shona, go home and have this done under your free health care, which of course is still a debate if it's free. But anyways, back I went to Canada, and I was unable to see somebody in enough time, and within 3 weeks I had to return to the United States and have my surgery, and it was a success.
All right, and the surgery, what did they do? They removed the tumor? What could you tell me?
They removed, yeah, through a transsphenoidal surgery. I had the tumor removed, and from there my vision returned within 10 days. I still have some ongoing endocrine issues because it's a complicated situation, but I feel very, very fortunate to be able to get into the United States and get the treatment that I did.
Had you not come to the United States, Shona, and you've been waiting for treatment in Canada, have doctors told you what would have happened?
Well, I was advised by my specialist, and when I told him what the wait times were, he looked straight at my husband and he said, unfortunately, your wife won't make it till then. And so we realized that the urgency of what needed to be done. And I'll tell you, when you're back up to those are words that you never, ever forget hearing. And at that point, you throw caution to the wind and you just do whatever needs to be done. And I was fortunate that I was able to come down and get the treatment here.
You know, Shona, there are a lot of folks, Canadians in particular, who email me. We've had folks like yourself who've been on who said that if they were left to the Canadian system, they'd be dead or darn near it,
right,
because of these waits. But in defense of the Canadian system, you hear, yes, but the good outweighs the bad because most people get care they wouldn't have, and most people have health records that would be the envy of the United States. In other words, longer lives, healthier lives, and that these cases and yours notwithstanding, that is still the case, is it?
Well, I would beg to differ that, because I think the one thing that Canadians don't do justice is we don't acknowledge how much we use the United States and their medical services, and we're really grateful for it. I know those of us that have used it. I crossed the border in order to fly down to Washington, and the gentleman who at the security at the guard, he had asked me why I was coming into the States, and when I told him, he recognized me from the ad, and he said he cannot believe that more Canadians have not spoken out, because the number of Canadians that cross through his border every single day coming down to the States for cancer treatment, for MRIs, for everything from emergency treatment to just diagnostic imaging is absolutely, because like there's just so many of them. And so this is the thing that I think that it seems to be our dirty little secret, and for some reason we want to hide that.
Well, one thing that's not, I'll tell you one thing that's not been a dirty little secret in this country is you've become the whipping boy, or woman should I say, for a lot of liberal bloggers, including almost daily on Daily Cause. And
yes.
So for speaking out, they're ripping you up. How's that going, and what do you think of that?
Do you know what? I guess part it hurts a great deal, and then the other part of me says, you know what? These are probably people that wouldn't want to sit down and have a coffee with me and find out the real story, anyways, because I've always made myself extremely open to the press and speak to anybody that wants to. But the thing that I find so sad is that you're shooting the messenger. Unfortunately, the message is still there, and if you want to attack the messenger, then I think that shows more of your character than it does mine.
What do your Canadian friends tell you?
My Canadian friends are being absolutely wonderful and very, very supportive, but then these are the same Canadian friends who gave up everything in order to help me get treatment and realize. I get daily phone calls and emails, people pleading me in order to get help, and what do they do when they run into these wait times and that they're frightened. And that's an awful thing to people to deal with. Other people are obviously very upset that I've spoken out and are considering it a very un-Canadian thing for me to do, and I think that's so sad, because you know what, we're neighbors, and good communication makes good neighbors. And
but we haven't been neighborly, Shona, with each other. I mean, the tension over this issue has developed where Canadians say, well, you don't think we're good enough, and they counter, no, we don't, and back and forth. Do you think this is chilling relations between our two countries?
Maybe I won't be allowed back home. You might be stuck with me permanently.
Shona, we could do worse. We could do worse. I want to thank you. Thank you very much. Continued good health and maintain that, and my best to your family.